Good afternoon, Rhode Island. Thank you for tuning in. It's great to be with everybody. Thank you to the press for covering this. It's a big week. It's an important week. I'm going to be on every day this week at 1 o'clock talking about the coronavirus, specifically around schools. It's one of the most important decisions that we will all be making. Will I send my children to school? Can we open the schools safely? How? What's it going to take? Over 100,000 kids are counting on us to deliver them a high-quality education. And so I've decided to spend a little bit of time every day this week sharing with the people of Rhode Island what's going to happen in schools K through 12 here in Rhode Island. I will say yesterday I had the opportunity to be on a conference call with the White House and 49 other governors, and every state is struggling through the same issues. If anything, Rhode Island is leading the way, and others are learning from what we are doing. And of course, I'm learning from what they're doing. But, you know, we're all in it together, not just here in Rhode Island, but as a nation. This is a school year we're never going to forget. And it is my hope that we are going to deliver a high-quality education to every student in the state of Rhode Island. It's going to be harder. We're all going to work harder. The children deserve it. We cannot, they've been out of school for too long already. We owe it to them to get them back in school. And I think we're going to learn many things in the process that will make us better as we go forward, even after we have a vaccine for the coronavirus. So we'll begin, I'm going to begin every day with a quick snapshot of the data, because we've all been working so hard, everyone out there and my team, to make sure that the cases are as low as possible at the time that we go back to school. And today is another good news story about the data. Yesterday, we performed over 3,500 tests. It's a lot of tests. And the percent positive rate was about 1.5%. We had 53 new cases. That's a great number, 53 new cases. And very sadly, another 2 deaths. Every day we continue to lose people to the virus, which is why absolutely every day, let's stay vigilant. Dr. Alexander Scott is going to talk a little bit more about the data in a couple of minutes, but I wanted to reassure you that Rhode Island is in a very stable place. 1.5% test positive, 53 new cases. That is exactly the kind of news we need as we think about returning our kids to school. I want to say it was 6 months ago today that we reported our first case of coronavirus here in the state of Rhode Island. I don't know about you, but it seems like a lot longer than 6 months ago to me. We've been at this every day for 6 months. And if I think about where we are now compared to where we were then, we've come a long way since then. Yes, the virus is still here, and sadly we lose people every day. But we've adapted. You know, we have adapted the way we do business, the way we live. We've developed systems for testing and contact tracing. Our hospitals are at the ready. So to all of you who've been working hard and struggling through this for the past 6 months, I want to say thank you. And I want to remind you, there is light at the end of the tunnel. There will be a vaccine. I don't know when. Members of the press may ask me, I don't know when. But we've been at this for 6 months, and in some number of months, we will have a vaccine. And so we just have to hang in there a bit longer. Okay, I want to take a minute to recap yesterday's announcements. Today's going to be a very short press conference. Yesterday was long. We threw a lot of information at you. So I would like to take just a minute to recap where we are in Rhode Island with public schools. Every single school district, except Providence and Central Falls, has been given the green light to return on September 14th to full in-person school for all students pre-K through 12. So that is crystal clear. Providence and Central Falls, their cases are a little bit higher, so they're going to start with partial in-person. They can't go full in-person. So they're starting with partial in-person. And Providence and Central Falls, we're going to reassess in about a month to see if they also might be able to go back full in-person for all kids. So every district in Rhode Island, except Providence and Central Falls, we expect, it's the state's expectation and RIDE's expectation, that the districts will provide an in-person, in-school, high-quality public education for every student. Now, that doesn't mean every kid has to be back in school on September 14th. We expect there'll be a gradual ramp up between September 14th and October 13th, where they'll gradually, over that month, get all the kids back in school, so that by October 13th, every child will be in school every day. Now, I want to be clear, because there was some confusion yesterday. If you're a parent who is choosing to keep your child home, that's fine. You can continue to do that, even after October 13th. That is your choice, and you will be provided with a virtual learning experience. But if you're a parent who is choosing to send your child to school, you want your child to be in school, then you deserve that. Schools will be open starting September 14th, and gradually between September 14th and October 13th, your school will move to a place where every single student will be in school by the 13th of October. And starting September 14th, they'll begin that process. So I hope that that is clear. Okay, today I want to spend the rest of my time with you talking about testing, because that's an incredibly powerful tool in our toolbox as we fight with the coronavirus, get back to normal in our daily lives, and as we get our kids back to school. From the very earliest days of the pandemic, from day one, Rhode Island has led the nation in testing. And that continues to be the case. We've run more tests per capita than any other state in the country. And we are continuing to run substantially more tests than our neighbors. We test about twice as much as Massachusetts per capita and 50% more than Connecticut. So again, that should give you some confidence. What that means is we're finding more cases of coronavirus, which allows us to isolate those folks and do contact tracing, which is such a powerful tool in keeping the prevalence of the cases low. At this point in Rhode Island, we've run just about 530,000 tests. So over 500,000 tests have been run, which is the equivalent, obviously, of more than half of our population. At this point in time, today, September 1st, our average turnaround time for test results is about 2 days. It's a little bit less than 2 days. And we expect it to stay that way. And there's no question that our aggressive and strategic approach to testing has been a key piece of what's enabled us to be so successful in keeping a lid on the virus. And frankly, it's also one of the main reasons that we feel so confident that we're ready to reopen school and welcome the children back into school. To ensure rapid, effective testing for our school communities, we are creating a separate, dedicated testing structure for K through 12 students and staff at public and private schools. Sorry, not just high schools, K through 12. So through this system, which we're setting up, which is above and beyond our existing testing system, we will have the daily capacity to run 4,000 what they call PCR tests, which are the highest quality, most accurate tests, with results being delivered to you within 48 hours. And on top of that, 1,200 rapid tests. And the rapid test, you get the results within minutes or certainly within the day. So I want to be clear. Testing is key. It is a key piece of the puzzle to keeping everybody safe. Right now, Rhode Island tests more than any state in America on a per capita basis. And we have gotten our tests The turnaround time down to 2 days. So that's best in class. We want to keep it there. That system's going to continue as it is. Separately, we have built a separate system just for K through 12, which has the capacity to run over 5,000 tests a day just for schools. 4,000 of those are the higher quality, longer turnaround time PCR tests, and 1,200 of those are the rapid, get your test results within minutes kind of tests. Which we've all become very familiar with now. You feel sick in any way, you cannot go to school that day. You cannot go to work. If you work in the school, you cannot send your child to school. You need to stay home and schedule a COVID test for that day. The way you're going to schedule that test is you're going to call a dedicated K through 12 testing hotline. As we get closer to school opening, we'll share that hotline. But it's going to be, this hotline is doing nothing but handling the volume from schools. Good morning, my child feels sick today. I'm not sending them to school. I'd like him or her to be tested today. Now, you should also call the child's primary care doctor, a pediatrician, or if you're an adult, your teacher, you call your own physician, because that's best care, and you can handle that with your physician. But in order to get tested, if you're an employee at a school, you're an employee at a school or a student, you call the K-12 testing hotline, and they will answer right away, and they will schedule you right away. When you call the hotline, you're going to be scheduled an appointment at one of our special K through 12 swabbing centers. So we are setting up a dozen or more special swabbing sites all over the state just for schools. As of today, we have a dozen sites already identified in Providence, Lincoln, Cranston, Pawtucket, Woonsocket, West Warwick, East Providence, Westerly, North Kingstown, Richmond, Newport, and Smithfield. And we are working to get even a few more sites up and running by September 14th. And we'll add more during the school year if we need to. So what does this mean? We're trying to make this as safe and convenient as possible. No one should have to drive more than 15 minutes to get to a testing site. We're being very conscious to have these testing sites on routes of public transportation. You're going to have a same-day test. You call a hotline to get it scheduled. And as I say, if we need to add more than a dozen, we absolutely will do that. But we're starting with 12 or maybe 14 sites all over the state. When you get to the testing site, they're going to run two types of tests on you. First is the PCR test, which is more accurate and takes a couple of days to get the result, and also a rapid test. So everyone will have two tests run on them. Now, you may recall a few months ago, I set up a testing task force, and they're amazing, and I want to thank them again. Dr. Curtis, Dr. Caliendo, thank you. They have helped us develop this entire protocol, so it is truly the gold standard for testing for coronavirus. The PCR test is a little bit more sensitive, and it'll take up to 2 days to get your result. On the flip side, the rapid tests, similar to what we used at the drive-thru in Twin River, are incredibly valuable because they help us to immediately identify positive cases. Time is our enemy with coronavirus. Speed matters. Speed saves lives. So that's why we're doing two tests. So if you go, get your rapid test, and it's positive, well, then we know immediately you are positive, and then our contact tracing operation can get right to work immediately and start with the isolation and the quarantine that's required for the folks that have been close in contact with you. When we had the rapid drive-through at Twin River, for instance, it enabled us to identify thousands of positive cases incredibly rapidly, which was a key piece of our success. You get the results in 10, 15 minutes. It's a little bit less sensitive, particularly on people who are asymptomatic. So that's why we're doing the belt and suspenders by doing 2 tests. And we want speed, but we don't want to compromise accuracy. So we think the dual approach gives us the best of both worlds. Now, while you are waiting for your results, even if your rapid test is negative, while you're waiting for the PCR test results, you have to stay at home. And now I know that's a cultural shift and a massive inconvenience, but it is the way it must be. So even if your child or you start to feel better by the afternoon, you say, oh, it was nothing, I was just tired, you need to stay home until we get the results, which will be a minimum of 2 days. If your test is negative, you can return to school after your symptoms have improved, as long as you're fever-free for 24 hours. The doctor will go into that. If your test is positive, then you need to follow the CDC guidelines before going back to school, which means you need to be fever-free for 24 hours with improving symptoms, and it must be 10 days after the symptoms first appeared. Which means when you wake up in the morning and you feel sick, mark down the date of when you felt sick. Go get your test, wait at home until you have your negative result. If you have your negative result, you can go back to school once your symptoms are gone. If it's positive, you have to wait at least the 10 days, and you, in any case, have to be fever-free for a full day. Let's say you're asymptomatic. Let's say you don't feel that bad, but you had a positive test. You still need to isolate for 10 days, for the 10 days after your swab was performed. So you go get your test, it comes back positive, you feel terrific, it doesn't matter. You have to stay home for the 10 full days from when you were swabbed. And if you're a student, you'll be receiving virtual learning during the time that you're home. Tomorrow, I'm going to spend time talking about what happens in terms of contact tracing and case investigation and quarantining if there is a positive case. So that's what we'll talk about tomorrow. Now, we also have to prepare for the reality that kids are going to get sick during the day, or teachers are going to get sick during the day. You wake up, you feel fine, you go into school, halfway through the day you feel sick. This has happened to everyone. Normally, what would happen is you'd feel sick halfway through the day and you'd tough it out and get through the full day. We cannot do that this year. So please talk to your kids and explain to them if they start to get a fever, if they start to get a runny nose or coughing, please, they have to let the teacher know because they're going to have to be sent home. We cannot have anyone with symptoms in schools. So now if you start to feel sick in school, you go immediately to the school's dedicated isolation room. Now I want to point out, every single school will have a dedicated isolation room. It had to be part of their plan to be approved, and when we do the walkthrough of the facility, we're going to make sure there's an adequate dedicated isolation area. They'll wait there in isolation until they're able to be brought home or picked up. Once you get home, the process is the same. Call the hotline, schedule yourself a test, get your swab, you'll get your rapid results that day, and then go home and wait for 48 hours for the PCR result. So hopefully that's clear, and everything I just said will be online. We're also going to be prepared to test certain asymptomatic populations through the K-12 hotline, particularly teachers and students who've been identified as close contacts to a positive case. If you're a close contact of someone we know has COVID, you'll be required to do distance learning, and we're going to need you to get tested. Close contacts will also get tested at one of our dedicated K-12 swab sites. But as long as they don't have symptoms, they won't get a rapid test. They'll just get the PCR test because we know the rapid tests aren't as effective on the asymptomatic folks. Tomorrow, we're going to spend the whole time talking about what happens if you test positive, how we're going to prevent outbreaks, how we're going to deal with all of the people in the classroom and in the stable pod of the child who has tested positive. So if you have questions about that, which everyone does, I'm going to ask you to hang on until tomorrow and tune in until tomorrow. So this is how we plan to do testing. It is a separate system we are setting up specifically through K-12, public and private. So if your kid is at a religious school or an independent school, same system. Call the hotline, schedule a swab, have the test, and then act accordingly.